10 or 20 years down the road, I imagine a world really where when a child gets diagnosed, he doesn't have to leave anything behind. When you get diagnosed, your life turns upside down. You lose family, you lose friends, you lose education. I imagine somewhere where a child can go just to get treatment while still being able to have everything else that was so important in their life.
So my vision is to really open access to children for novel products early in their product development so that these treatments can get to children faster without having to go through adults first. So my vision would be to try and change the federal regulations to open access for all children.
It's of course understandable that we focus on the medical care, but we need to recognize that kids are still kids when they're in the hospital setting. I have this vision in my head of a hospital where it looks more like a playground than it does a hospital, and there are play spaces throughout the entire hospital. If we could have outdoor spaces, that would be great too.
The idea that you could bring alternative healing modalities to patients in a traditional healing setting. Yoga, mindfulness, healing touch, aromatherapy, and those are things we might be familiar with in our own lives. Maybe we see an acupuncturist or where we take yoga for our own well-being. That's something we could be bringing to patients and families, to every patient and family across the whole health system.
Technology is like the #1 thing now. I want doctors to go back to doing home visits with their patients. With technology, you do have Skype. You know, mostly everybody has iPhones, so you have FaceTime. You can make that appointment. Okay, I know I don't have to pick up the kids until around 3 o'clock, so I can make this appointment at 12, still be at home, and still be able to get my child at 3 o'clock. So,
my big idea is to strive for a world in which where a child lives doesn't determine if they will live. It would mean that every child would be able to grow up stronger, and it would make my parents proud because they would see that their child was able to make a difference in the community.
There would be this dream team of people whose job it would be to identify those children who are in poverty, who are at risk of toxic stressors, and to make those interventions. I think that what we would see as a hospital would be less of those readmissions for asthma, for example.
My big idea is creating an environment where everyone in the hospital are powerful, strong, impressive communicators so that we change the experience that families have when they come in the hospital. Our goal is cure. It's always cure, but we're not going to always cure everyone. And if we don't, we still need to offer an experience that families can go home and live with.
We have so much already that shows me that we're really working in that direction.
Oh, we're like there. This is us. This is the starting line. This is us.
There are already pieces in place.
I do feel that the time is now to make this happen, to create a change.
If we continue on this path and we keep improving and we keep putting the kids and their family first, then eventually, soon hopefully, we'll be able to accomplish everything that we want.
Under Kurt's leadership, Children's National has become a major player on the national stage. Now we should aspire to be a major leader in the health and welfare of our children. Let's raise the bar on innovation, research, clinical care, community outreach, public policy, and governance. We can have the team at Children's National to do this. We can have a powerhouse board to make this happen and oversee their great work, and we will, because Children's National is the place to be.
My big idea is to build a research and innovation campus at Walter Reed where we will push for new treatments and cures for kids and families. I want to unleash the great minds and the enthusiasm and the energy that all of our people have for pediatric care. I feel really positive about Children's National. We've always stayed focused on kids and families, and that's what we need to do, and if we do that, we're going to succeed beyond our wildest dreams.